Federal government has set up a committee to review the demands by the striking workers of the joint health sector unions. This was part of the decisions reached at a meeting of top government officials held on Sunday night.
Yes, and the Director of Press Office of the Secretary to the Government of the Federation, Lawrence Ojabo, says the government is working to ensure health facilities nationwide provide normal services. Well, TVC News' Kemi Balogun paid a visit to the National Hospital in Abuja to see how patients are dealing with the strike.
Waiting areas here at the National Hospital are close to being deserted. Relatives and patients in waiting rooms can all be seen wearing long faces. Some patients who can afford to move can be seen leaving to alternative hospitals, mainly private ones who are not affected by this recent strike action. Halima Ahmed cannot afford to move her brother, who is battling with cancer.
My brother has cancer, and now no nurses and other workers because of the strike. We bought blood, but now we can't even get it. I am here praying that the government will look into this situation and solve it. We came all the way from Bauchi State to get him treated.
Other patients in this waiting room expressed their displeasure with the strike action as they narrate their present ordeal.
Almost 2 hours, they see the doctor again. I start searching everywhere. And I said, the doctor, say, how far now? He said, madam, as you see the strike now, we cannot enter inside theater. We cannot open the theater. So I have to look for a solution that we take him any private hospital that they can do it.
I'm here because my sister is sick and they say she needed an operation. We'll be here this morning. And they said the doctors are on strike. She's feeling pain seriously, severely, that she needed attention urgently. But the doctors are nowhere to be found.
Meanwhile, the hospital authority says it is doing all it can to ensure that patients still get the care they need.
We have arranged to make sure the doctors who are not on strike are on their duty post. And I tell you that the clinical areas are running. The doctors are seeing their patients, So we appeal to patients to come and see their doctors in the hospital.
No one single profession can handle diverse, multidimensional issues of health. Apart from that, each person has a role to play, and no doctor can play the role of all of these professionals. So I can't understand what they mean they can do everything, but you can verify if you go to the wards and see that patients are satisfied with what is happening now. That's one point. If you come back here later on, this will be like a desert. Nobody will be here.
This recent strike action is the second in 6 months, and it comes after a 30-day ultimatum given by the union to the government. Patients who are stranded due to this recent action are calling on the government to find a lasting solution to the disagreements between the health sector union and the government. Kemi Balogun, TVC News, Abuja.
All right, joining us from our Abuja studios, the President's National Association of Nigerian Nurses and Midwives, Comrade Abdurrafiu Adeniji. Good morning and thanks for joining us.
Good morning. Good morning.
Okay, glad you can hear us. Okay, now this strike, Joheso strike, is obviously taking a toll on the health sector. The federal government has set up a committee to reconsider Joheso's demands, while of course begging or pleading with Joheso to go back to work. Talk to us about the development so far.
Good morning, Nigerians. It is so pathetic that this morning we'll be sitting down to discuss the issue of strike by Joint Health Sector Union, because members of the JOSU have tried everything possible to ensure that there is no breakdown of industrial harmony in the health sector. We were on strike September last year. That was subsequent upon 2014 industrial auction. we were able to seek a memorandum of understanding and agreement with the government of the Federal Republic of Nigeria, as chairman by the Minister of Labor and Employment, where all other government agencies and relevant stakeholders were present. The federal government were to implement the terms of agreement in 5 weeks. Our own condition as at that time was that matter of 1 week or 3 weeks, they're supposed to have met our demand, because we are sure and we are confident that the government is in position to meet all this need. But when this thing was not coming into being 5 weeks past, in February, we gave government a reminder with a 21 days ultimatum. This one expired, and then the first day of March 2018, we gave another 30 working days ultimatum. This amount to 45 days altogether, with all the public holidays and weekend altogether. And we believe that government are handling this issue with levity.
And now you have gone, of course, and now the strike has entered day 7. Yeah, we do understand the background of this. Thanks for laying it out there for us so that Nigerians can understand. Now, the FG has set up a committee to reconsider your demands. What do you have to say about this committee that's been set up, and do you have confidence that this might just move things forward positively?
Thank you. What I'm trying to say is that we are not aware of that committee. If the government is negotiating with USU, when they set up the committee, they ought to communicate. In any of our communication with government, we do communicate formally. There has not been any written document to this effect. And this is giving every Nigerian a concern. You cannot be negotiating in proxy. They cannot be negotiating on the social media or the mass media. We were on the negotiating table before they caused the breakdown of a negotiation. They should be able to effect coming down to the negotiating table. And I want to say that the issue of setting up a committee does not necessarily mean that we'll be satisfied to bring an end to this strike.
Okay.
Anything that we bring about the end to this strike will be practical thing that we see on the table.
All right, comrade, the government has accused the Johesu of being insensitive, that they were working, they said they were working towards this, and then you went on strike. And they said they were threatened to impose the no work, no pay. Talk to us about that.
Thank you. You see, a dog can call cat a thief, because if the cat is not bold, is so patient and considering what is in the house. The government are the one that is insensitive, and we pity the situation of the Nigerian citizen. They are the government at the center are surrounded with people who are covering the fact, and they cannot turn around and accuse USU of being insensitive. If we are not sensitive, we will not bring the industrial action to an end in September. If you are not sensitive, we will not give them 21 days ultimatum that they claim is not enough. If you are not sensitive, we will not give them another 30 working days ultimatum. If you are not sensitive, we will not go to a meeting on the 5th day of April to tell them that we still have 12 more days for them to meet the demand. It is rather the Federal Ministry of Health that is being headed by insensitive handlers that are throwing the government into this kind of pitiful situation. We are very sensitive, and we are on the part of the masses, and what we are working for is may bring pain today, but at the last is going to bring gain for not only the health workers, but also the entire populace of the country, because there will be increased quality services delivery. There will be more harmony in the health sector if everything we are looking for are attended to. So by all standards and by all judgment, JOHESU has been very sensitive. In fact, by our members, we are like toothless bulldog, and that it's as if we are not representing the interest very well. And if I were to be a follower, I will also think that of a leader who have been sitting at the table since 2014 and nothing has come to the table, whereas some other people are having whatever they are looking for. Is it because we are not on strike? If other people are on strike, they will have what they want to have. As regards no work, no pay, it's an empty threat. I say it with all emphasis that it is an empty threat, because we have taken the permission of our members before we commence on this strike. And if they like, they can withhold the salary. All I know is that by the time everything is come to an end, our salaries will be taken, because it can still be subjected to a judicial process.
Okay, let me come in, if I may. The NMA, the Nigerian Medical Association, doesn't seem to be in support of this strike. As a matter of fact, they believe that this strike is actually targeted at them, and they've asked government not to, or to actually be careful to accede to your demands on the one hand, and then you say that you're fighting for the masses. Don't you think the casualty levels at the hospitals now is too much a price to pay for the demands you're asking of promotion of arrears, improved work environment, and all of that?
Like I said, I want to use this opportunity to appeal to the Nigerian masses. It is so painful, it's pathetic, that the people we give the affairs of the health sector in this country can allow the people to be suffering. And I'm calling on the central government, I mean the federal government has been headed by General Buhari, to look the third eye, to look behind the people that are representing him at the Federal Ministry of Health. Honestly, these people have proved to be an incompetent leaders. The situation that comes into being today, that the words of members of Nigerian Medical Association, I'm always very conscious, and I don't want to join them in any debate, but they have dragged us into it. It is true that the members of NMA are in government here and there, and they are using that maximally well against other people. When you have a leader that knows that health sector is a multidisciplinary sector, that have diverse people of background, and that people that will contribute maximally to form a team, then when we are acting, we must take the interests of other people into consideration. NMA has no business in this negotiation, because they are not the employer. But the Federal Ministry of Health is in the habit of taking their words as if it is the employer's view. Though they have all the ministers, they have everything. But the situation is that NMA, if they want to know what to do, I expected to call on the government to attend to JOHESU. In any of their strikes, JOHESU had never put hands across their way. But they are the type of people that are living in glass houses that are throwing stones.
Yeah, but are you concerned about Nigerians that are dying in hospitals now?
Can you hear us, Comrade?
HSS apart.
Comrade Adeniji, are you concerned about the toll that this is taking on Nigerians? Yes. Many people are going to the hospitals, they're not attended to, and many, unfortunately, have lost their lives in the days that you have gone on strike.
Well, unfortunately, we have considered all this, and that is why we are pleading with government for years. The NMA are full of themselves. They believe they can do everything without others. In fact, when you listen to some of the comments today, they are saying that the services are running. But the situation is that make a visit to all the hospitals. You will see what they have thrown the health sector of this country into. In Zimbabwe, the Association of Doctors, knowing fully well that this is a teamwork, go against government who said that they have dismissed all the nurses and midwives. In Canada, the government throw out more salary to the doctors, but they came out, this doctor came out to canvass for more good condition of service for other health workers. But in Nigeria, the first is the case. Yet, we are claiming the international best practices. Let me say that we are aware, and that's why we are doing everything possible to ensure that by the time the government want to end this strike, they approach USU, who they have abandoned, and then they will enthrone negotiation, quickly make this negotiation, because what is left in the negotiation is just for the government. They have signed an agreement once. Let government go back to their archives, draw out this agreement and implement the agreement. Nobody forced them to sign the agreement in September 2017.
Yeah, comrade, the NMA also said that Johesu as a union is illegal. They said it's illegal, and Nigerians are quite concerned about this. And then number two is that your union also called on state and local government midwives and nurses association to join in the strike. And a lot of people are saying that is very an insensitive call to make.
Thank you. What constitutes legality of a trade union outfit in Nigeria is the application for registration as a trade union. And all the 5 unions under JOESU are registered trade unions. The act that has to do with trade union practice in Nigeria recognize that in any industry where we have people of like business can come together to form a joint action committee. The joint action committee of people working in health sector, except the medical doctors, is JOESU. When you go to the university, you have people like the NASU, the NAT, and the other people that comes together to form a joint action committee. Let me, but for the purpose of education, say that JOESU is formed by Medical and Health Workers Union, which is the foremost trade union in Nigeria. National Association of Nigerian Nurses and Midwives, which is a recognized trade union and professional association in this country. And non-academic staff union of universities, which is NASU, which is also under NSC. We have Senior Staff Association of University Teaching Hospitals and Allied Institutions, SAITRI, which is under TUC. And then we have National Union of Allied Healthcare Professionals, which is also under TUC. These are the 5 unions. And along with this union, we have APA, which is Assembly of Healthcare Professionals. The Assembly of Healthcare Professionals has nurses, pharmacists, lab scientists, radiographers, optometrists, and everybody that has to do with clinical professionals in health sector. We are registered trade union coming together to form a joint action committee, and I know the law of the land knows this, and that is why the federal government can sue us and we can be sued.
All right.
Let me tell Nigeria for one thing: NMA is not a registered trade union in Nigeria. We are aware of this, so they cannot turn back to be calling a registered trade union an illegal body.
That's interesting.
So are you categorically saying that the NMA is an illegal body? Is that what you're saying?
Okay.
Okay.
Wonder if you heard that question. If it didn't, it's a question that is blowing in the wind. We hope that the NMA will, seize the opportunity to respond to some of the issues that Abdurafiu Adeniji, President, National Association of Nigerian Nurses and Midwives, the issues he has raised. One doctor to 4,000 Nigerians. That is what it is right now, as against 1 to 600 recommended. Thousands are going out, billions are being spent on medical tourism and all of that. Nigeria really needs to up its game in terms of ensuring that the health of Nigerians is put where it should be. I guess
All
that's
right,
how
we have to run it off right now,
Yeah.
but certainly we have to run through the papers to let you
very
know
quickly.
what the papers say today.
All right, this day, National Assembly executive head for showdown over unapproved $496 million withdrawn from the ECA.
Excess crude account.
Excess
now we
crude
have
account.
the Vanguard newspaper. South African police look on as mob burns Nigerian. We also have other headlines here. Excess crude income hits $65.4 million daily.
And the Daily Sun, Oshomole versus Oyegun APC in fresh crisis. Controversy trails a South-South meeting after Oshomole's endorsement. And IPOP to Buhari don't run in 2019. That's the Daily Sun.
And the Nation newspaper here says South-South APC leaders in stormy talks over Oyegun. And Oshomole's endorsement stirs division. And Tinubu seeks fair convention. We also have other headlines here on World Bank. Diaspora remittance hits $22 billion. That's in Nigeria.
And finally, from The Punch, there's a plot to kill me, Melaye says, as police lay siege to home. Melaye failed to honor summons. That's the police saying there. Saraki Dogara, others meet over maize theft. And Oyegun's been warning the APC, let's not take things for granted. 2019 elections will be tough.
All right, this is where we come to the end of today's edition of the program. Have a great day ahead. Tomorrow we'll be back again with other issues that concern Nigeria, Africa, and the world. I am Mike Okwache.
And I am Ngozi Alibu. It was nice doing business with you. Let's see you again tomorrow, as usual, bright and early, 7 to 9 a.m. Bye now.
The National Hospital are close to being deserted. Relatives